This is to the governor. So, Governor, I guess we've been waiting for this moment for quite some time. What finally made you decide to go with the mandate?
Well, first of all, let's, this moment has been happening over the last month in every school district in the state of Rhode Island. The discussion about masks has been going on in a public way that we encouraged, all three of us up here, the leadership up here. So anybody who was watching, each time you saw a school district, adopt a masking mandate, we were getting closer and closer to it. We just needed patience to have it all roll out as it has. And so now we're just, as the commissioner said, virtually every district in the state has either passed a mandate or they have indicated that they will pass a mandate. So as schools opening up, it's 3 weeks away from today for most schools in the state in that range. We believe that this is a good time to finalize that work that has been happening over the last several weeks. And again, I thank each and every school district in the state for adopting a mask mandate and opening up those conversations in a public way.
All right, great. Over here with John.
Yes, and Governor, I just want to clarify. I heard the mention of 90% of teachers have been vaccinated. How do you know that? And is that a mandate that these are public school teachers, have to be vaccinated to be in the classroom?
We haven't made any mandate there. That's the data that I received, in the spring when we were vaccinating teachers and related staff. I mean, we can confirm that, but that hasn't changed since when I was told that's the case, as well as our child care.
Okay, and I just want to, coming up at 3 o'clock, healthcare workers, some of them are rallying against the mandate. I want to just clarify, they have to be vaccinated, I believe, by October 1st. And do you have any message to the frontline workers that at this point are refusing to be vaccinated?
Yeah, so we need to get all our healthcare workers vaccinated. That's why collectively we made a decision to do that 10 days ago, or whatever it might be. And I was happy to hear that the President of the United States said the same thing yesterday, that healthcare workers need to be vaccinated. And I won't get into the details. I'll let the doctor handle some of these details, but it's pretty well known at this point in time that booster shots are coming, and the people who are going to get the booster shots are going to be in an age group that is predominantly in our nursing home settings and in our healthcare settings. We cannot afford to have anybody working in those settings that's not vaccinated as we come up on the potential time frame, which is a few months away or whatever it might be, away from needing to make sure that we get booster shots to the people that they serve. So we hope and we expect that all healthcare workers will get vaccinated in the state of Rhode Island. I do believe, as I've said before, the FDA approval is going to make it very, very certain that anybody who's been holding out for because they thought that there was a health issue with getting vaccinated, which we continually say there isn't, but that's going to make clear the deck on that one. So we need our healthcare workers to get vaccinated, and as I mentioned on that vaccination issue a few weeks back, and was reported that we're in good conversations, strong conversations with our union representatives and leaders to impact a vaccination strategy for state workers too. What I would expect that you'll be hearing more about that next week.
Governor, hello. What emergency orders do you want to exercise but currently lack and need the General Assembly to come back and restore? What do you want to do? And what does this new emergency declaration change?
Well, the action by the General Assembly when they passed the budget and the statute did not end the emergency in terms of the basic emergency order in. What it did end was my ability to give executive orders under that emergency. So what this does, and people couldn't. I've been talking to the Speaker and the Senate President today about this very issue. We expect to be meeting early next week about potentially addressing it. But what this current order, based on the Delta variant, it is a way to exercise the authority I have in a way that addresses this one specific Delta variant. And under that order that I'll sign later today, we can sign executive orders related to the Delta variant, as we will with the mask mandate.
And the first part of the question, what do you need the General Assembly to come back and restore?
So what we had asked during the budget process, as the discussion was to pick a date of September 1st that basically said that the COVID emergency would be over September 1st, because again I was not able to execute any executive orders under that that overriding emergency orders. That's still in place, as we've talked about. We're still taking advantage of all the federal dollars that could possibly come in. By the way, that's been extended now to December, the end of December. So we're pretty, we're smart to be able to do that. So the General Assembly knows, I think they understand that at this point in time, we're going to have to do like end arounds going forward. Now, when the Delta ends, we're going to have to decide whether that executive, that emergency order ends. And as it was, which Tom said, we're looking at early fall. But there may be another variant that's going to come in. We don't know what's around the corner. So what we're asking is, go on the original emergency order that was put in place by Governor Raimondo. Don't have it expired 180 days as the statute said, and extend that as we requested at the time that the budget was being passed, to have it extend into January, so that we don't have to do these end arounds to address a pandemic that hasn't ended.
Dr. Scott, I have personally interviewed mothers in tears because they see masking as literal torture for their young children. They remain unconvinced that cloth masking, particularly on a young child, has little more than a placebo effect. What substantiation do you offer to them beyond masks work? Under what circumstances will the order stand down? And finally, it is no secret they have organized statewide. Are you in the state of Rhode Island prepared for noncompliance?
We have countless examples of data stories locally, nationally, and internationally that show definitive improvements in our case rate data when masking is required. Just based on the science of how coronavirus and other respiratory viruses are transmitted, masking is an effective, doable tool that stops, inhibits, and slows transmission of that virus, that organism, from one individual to another. We have not only seen decreases in cases regarding coronavirus, but have also seen decreases in cases regarding other respiratory viruses when masking was required. You can ask many of the teachers nationally or the students themselves. Our students have done great. They have really been the champions in being able to say, we can do this. We can wear a mask. We can be safe. We would much rather do that and be in person, in school, benefiting from all of the positives that come with that, rather than not wear a mask and have to risk staying home or deal with the many disruptions that occur from the countless outbreaks that we are seeing nationwide, including what I shared earlier today, when people are not masked. So we hope that the science, the data that we're saying consistently, that is being demonstrated time and time again, is enough for the parents who are out there to know we are with them and wanting to make sure that their children are safe and can get the best education they need. This is the way to do it, and it's going to be necessary across the board. So we hope they can join with us.
The rest of the question, though, under what circumstances, what metrics, what objectives will the order stand down? And again, it's clear that they've organized statewide. How will the state respond to noncompliance for public education?
We will continue to follow the data and look for the flattening of the curve that we're expecting to see in terms of making decisions about how to proceed from there and make those recommendations to the governor, as we have been and will continue to do as our responsibility going forward. And in terms of how to handle, we hope that that won't be the case, because people will understand what the data and science is saying, why this is necessary, and how it can be beneficial for all of our students. And we'll take it as we go from there.
Final thought. You'll provide us that data as they talked about earlier in our conversation, that substantiates your position?
We continually do. We definitely welcome everyone to go to our website, health.ri.gov. We have a tremendous data hub there. It's where we want that to be a resource for all Rhode Islanders. We have an A-plus data team at RIDO and with all of our partners, so please take advantage of that.
Okay, we're going to move on over here.
Dr. Alexander Scott, we keep hearing about the booster shots being available next month. If you are a nursing home resident, what will that process look like, and are you hearing any specific dates for next month?
Yep, we're continuing to work with our federal partners to better understand what the optimal rollout is. And similar to how we have approached everything thus far, we're making sure that Rhode Island is ready. We have the capacity in place, we have the partners who are lined up, and we're going to be eager to get going as soon as possible. And we'll certainly be looking to see how early we can make that date and make the vaccine available. So time will tell as we continue to engage with our federal partners, but Rhode Islanders have experienced and will continue to know that we're ready.
All right, thank you. Steve?
Governor, good afternoon. Governor Baker in Massachusetts today issued an order that's been described as one of the strongest of its kind in the nation, ordering all executive department employees to be vaccinated by a date certain, October 17th, or face disciplinary action, including an up to termination. Would you consider such a thing? Is this part of your negotiations with state employees here?
Yeah, we'll have details on that. We announced that. It was reported, a few weeks ago that we're in conversations about vaccinations for our state employees. I can't tell you the details right now, but I did talk to Jim Thorson earlier today about this specifically, and he was very optimistic that we will have some form of vaccinations policy in place. It's not easy, it's complicated, and we want to make sure that we do it right, and I would expect that something will become available in terms of information next week.
What do you think of Governor Baker's order?
Well, I think that, first of all, I was on the phone with Governor Baker talking about some of these things earlier in the week and comparing notes, so I know that he's a good governor, so you always can learn from good executives. So we'll take a look at what he said and see whether that applies here in Rhode Island.
Commissioner, this is the third year in a row that schools are going to be disrupted by COVID-19. If a student has to quarantine, there might be learning loss again, and packets for 7 to 10 days aren't really cutting it for some teachers and parents. Can you kind of just give us an update on what the state or the LEAP task force is doing to address the learning loss for this year?
Sure, but it hasn't been 3 years, just to be clear. COVID-19 started in 2020. So what we are doing and what the districts are doing is ensuring that the students have the extra support that they need for the time that they've already been in a very difficult situation. So moving forward, there will be programs that will continue during the weekends, after school. So there's a lot of things that is directly related for the students. That's what we're doing right now, and that's what the districts are doing. All of the district plans that will be submitted on August 27th will include the instructional portion. So those we will be able to make public so that everybody knows specifically what their districts and schools are offering.
Okay. And then, Governor, according to the CDC, every single county in Rhode Island currently has high transmission as of this week. Why aren't we implementing a statewide indoor mask mandate for all businesses? And are you still standing strong that it could affect the economy, could affect small businesses?
Well, I think that we're addressing the masking, over the last several weeks with all the local districts. I'm very happy, again, that they stepped up, and I think virtually every district in the state of Rhode Island has come to that conclusion without a mandate. We're putting the mandate in just as a precaution today. As far as the economy goes, we are doing fine. Our hospitalization rates are nationally are certainly leading. I've mentioned that reporting on the key issues in terms of death rates, in terms of infection rates. We were I think the third strongest infection rate per capita last week. We'll see where we are before we make those determinations. But we are holding on, which is critical. I mean, in terms of like the economy. Third in the country right now, number one in the Northeast in our recovery, and yet we still have been able to keep people safe and relatively out of the hospital and continue with the vaccinations. We'll deal with that at the moment in time where it might be need to be dealt with. Right now, I don't see that as something that we should be doing today. You could be doing it next week, but at this point in time, let's get people vaccinated. Let's keep people safe. And today we're making a move on to make sure we open our schools safely.
So just to be clear, that you're looking at hospitalizations and fatalities related to COVID in order to implement some type of indoor mask mandate, and what would that threshold be?
Yeah, so I don't think that's determined. Look, we got a pretty good team up here that's had a lot of success, and we all have our strengths, and we certainly go to our strengths. So this is a collective effort at this point in time. We're taking care of the finishing ideas on the schools. We're making you aware that the whole process has been complicated by the General Assembly, calling that September 1st was the end of the COVID pandemic, and it has complicated things to a certain degree. We're in a position to make those moves right now as long as the Delta's there, but that's why we would like to, we're asking the General Assembly to consider to come back and reinstitute the full authorities and not have me have to use certain authorities that I have that, are a little awkward. So, and I think it's been awkward even in the explanation over the last several weeks in terms of I don't think everybody's really grasps, what we're dealing with in terms of getting through it. Right now, we're going to do the schools. We're going to get those open safely. We're going to evaluate all the issues. We'll make those decisions based on data. Today, we're not in a position where we need to roll back our economy. And individuals know we're making it very, very aware of the Delta that we're having. And people can make their own decisions on what they particularly do. But at this point in time, we're not going to issue any form of restrictions into our business community.
Thank you. We have time for a few more questions.
Tanya Signori from the Rhode Island Wave. If you look at the numbers, there's technically a 98% chance of surviving COVID, which is actually very good news. If you look at all the numbers that are on the website, thousands of Rhode Islanders have had COVID from day one, and about 2,700 or so have died. I personally know 3. It's a very sad and a very, very scary situation. I am not minimizing deaths. I am just saying, overall, numbers are numbers. It's a very low chance. That doesn't mean we can't be safe still. Let's be safe, let's get vaccinated, let's wear a mask. Why can't it be people's own personal choice, though, if they want to be vaccinated or wear a mask or both or one or the other? I myself have been vaccinated from earlier in the year, but I don't feel I need everybody around me to be vaccinated to feel safe. I could stay vaccinated, I could wear a mask. Why do I have to expect, so for example, if someone has a compromised immune system and they walk into a church with a mask on, that's good. But it doesn't mean everyone else around them has to wear a mask. So when are we going to come to a place where it's a little more relaxed and people can just take care of their own health and be their own self and say, okay, I'm not going to go to a crowded event, I am going to wear a mask, I am going to get vaccinated? When can it come to a point where Rhode Islanders make that decision for themselves?
So I'll let the doctor handle the medical side of it. I'll just tell you where we stand on that issue, right? It's our job to collectively come together and make sure that we make decisions in the broader communities, keeping them safe. The things that we're doing here today are not done, without a great deal of thought and a great deal of data. So as long as I'm convinced as governor that we need to put these precautions in place, these type of policies in place, we're going to do it. As I've said, safety is our #1 priority. We want our economy to open up, but again, if our economy is at risk because our health is at risk, we're going to side on the health side of things. And then as far as the schools go, those have been one of the 3 top priorities for me. Health is #1 priority, making sure that the economy opens, and making sure the schools open safely, and I think that we're headed in that direction. If the doctor wants to weigh on some of the medical reasons why we need to do this thing, I'd be happy to.
From a public health perspective, particularly when you have the Delta variant as transmissible as it is, it no longer works to say one person can mask and vaccinate and the other person cannot. When you have pockets of unvaccinated populations in place or unmasked populations, that overflows and impacts the areas where people are vaccinated and or masked. And so we need to take a public health population-level approach in order to keep everyone safe in the midst of the surge of this Delta variant right now.
Thank you. Last question.
For Commissioner Infante-Green, well, it's two parts. Last academic year, we had choices that individual parents and students could be virtual out of school if they did not feel comfortable being in school. And under the present circumstances, I think that there are going to continue to be parents and students who might opt to continue virtual learning if they are uncomfortable for whatever reason with the risks of being in school. If they have an individual concern, the child has a health issue, is immunocompromised, they don't want their kid wearing a mask, whatever it is there going to be a similar option that schools are expected to offer for students and parents who would prefer to avoid in-person education?
So let me start by clarifying. For those students that are medically fragile, there is an option for them. So that's first and foremost. If we go back to the President's mandate of going back to school in person, that is what we are doing at this present moment, is making sure that our kids get in-person instruction, which we know is the best form of education. Also, socio-emotionally, we know that the kids benefit from it. So right now, that option does not exist. That's why masks are so important. That's why vaccines are important. We have to follow the science and keep moving forward.